Hey there, I'm Jen Rice, and I wanted to talk a little bit today. Actually, I've been getting such great feedback on the video I did on autoimmune. I think it was last week. I even had a neighbor stop me last night walking my dog and saying that she saw the video and she's so glad that we're talking more about this. So I really wanted to jump on here today. I'm kind of going to take a little different twist than some of my content that I've been doing and talk a little bit specifically about my journey through this functional medicine and what I'm learning about just everything around autoimmune in general. Now, I think I mentioned before, I don't personally have an autoimmune condition, but I did have a health issue that brought me to a functional medicine doctor, and I've been learning so much from her. So I wanted to ask you guys if you've ever heard of leaky gut syndrome. It's something that has to do with intestinal permeability. Basically, the way they describe it is that over time, from inflammation that can either come from medications, stress, antibiotics, viruses, pests, parasites, just things that we come in contact with, that these things over time, right, we're talking often many, many years, so even since we were children, babies, up to today, right, over time, that putting the strain on the gut, and certain things in our diet, of course, too, can cause this permeability. So whereas the cells are like really tight like this, right, and when we're really healthy with our gut, nothing is getting in and nothing is going out into our circulatory system like the rest of our body. So when it becomes a little bit disjointed, I kind of liken it to like a paver patio with sand, right? So when you've got plenty of sand in there, all the pavers are real tight. If the sand starts to get a little bit out of place, you have a weed grow up through. So this is what's happening where the intestine begins to leak certain things out of it, which aren't necessarily, let's say, toxic, but our body doesn't notice it as something that it reacts to it. So that's where you start to see sort of these hypersensitivity reactions. A lot of people kind of connect this to maybe the cause of some psoriasis or eczema, or certainly hive rashes. All of these other things that we see that are considered maybe a hypersensitivity reaction can come from this type of concept. And although at first, you guys, honestly, when I heard this, I thought, okay, I'm a Western medicine trained, mostly for dermatology, but certainly we trained in all fields of medicine. And I take a little warming up to adopt any sort of concept. So I started doing some reading, and actually I was reading about a physician at Georgetown University. Her name is Dr. Robin Chutkan, and she is an assistant professor of medicine at Georgetown University and founder of Digestive Center for Women. And basically she's been, I guess, leading and on the forefront. I think I found her through even like a Dr. Oz, like mainstream, where she was saying that leaky gut syndrome is likely to emerge as one of the most significant medicine concepts of our time. One of our most significant medicine concepts of our time. Why do they think this? Well, if the intestines become, let's call them leaky or permeable, so things are seeping out into circulation, other things are kind of coming in. They talk about celiac disease, Crohn's, IBS, of course, certain foods, alcohols, these kind of things. We know that if the container isn't, if it's a little leaky, you're going to have things go out, right? So to me, this is so key because when those toxins leak out, it triggers the immune system to look at it as like, oh, there's an invader. We need to go over there, see what's going on there, and attack it. And that can cause other inflammation. So, I got to thinking, okay, so for me personally, just to say real quick on my story, I had this heartburn that had really started to kick up for about, maybe a month and a half or so. And so I, like any good PA, I went to the drugstore and I picked up the things I would take over the counter to get rid of it, right? So one of them was Prilosec, and then there were some other antacids. And so I began taking daily Prilosec, which is omeprazole, over the counter, and it's a proton pump inhibitor. Well, unfortunately, that landed me in the emergency room twice in June for what they call angioedema, so allergic reaction on my lips. And I couldn't really pinpoint what it was, and it didn't really occur to me that it could have been one of the medicines I was taking until the ER doctor on my second trip told me a story about his wife having the same reaction, although hers was much more severe. I did get myself some IV steroids and, too much probably medical treatment. If anybody knows me, I don't really like being a patient. I like being the caregiver, right? So, June was a rough month. So my options were, obviously I stopped any medication, but I was still uncomfortable. So my options were, number one, I go my Western medicine path. I go to, a GI doctor. I knew that would land me more towards endoscopy, maybe colonoscopy, certainly more medicines. And I didn't really want to do that. I've been in the GI lab. I think that that work is important. It's necessary, but I wasn't sure that I wanted to go that way. So I went to the functional medicine doctor that I talked about. I think it's been 3 weeks ago, almost 2 weeks ago, 3 weeks ago. And she placed me on an elimination diet. So that elimination diet is what I'm kind of talking about today, where it's really one of the solutions for this anti-inflammation diet. So it's no refined sugars, no dairy, no soy, no caffeine, no gluten, no alcohol, sad face, no artificial sweeteners. So I'm almost 2 weeks in tomorrow. Who's counting, right? But I'm doing it 21 full days, and then we're kind of reassessing. I will be honest with you and say that I am doing great. I'm not taking any medication, and my symptoms are very minimal, if at all. And it's not easy, but I'm sharing this, even though it's a little bit uncomfortable. I'm sharing this because I think it can be helpful to someone, and maybe someone because it seems like now every other person I ask or even see in office is on some kind of heartburn medication, or they have a thyroid condition, an autoimmune condition, arthritis, rheumatoid arthritis. Now, granted, I see a lot of older patients, and these things do happen over time. However, I'm seeing a lot of patients my age and younger with similar things. So then you start to think, right? Okay, so I wanted to talk real quick about, because that physician was talking about how could this really be the foundation of a lot of diseases, right? Because the one thing that got my attention that my doctor mentioned is she said, we do this now. Yeah, okay, we fix the gastritis. Cool, right? But we might also fix underlying cardiac brewing stuff, because even though lab work looks great, like Western medicine-wise, looking good, but is there low-grade inflammation? And is that like a ticking, kind of like a ticking time bomb there? And that got me thinking a lot about that. So anyhow, I've committed to this elimination diet. Nice side effect of it is weight loss. So if you're interested in that, it's not super easy, you guys, I'll be honest. There's parts of it that are easier than others for me, but I'm Irish. Okay, so 10 signs that you might have a leaky gut, okay? And I'm not giving like medical advice and saying you need to do my diet and you need to do it. No, you need to take this information, take it to your doctor, discuss it, bring it out there, or take it to a functional or integrative medical physician, and they'll help you too. Okay. Hey, Lisa, I'm so glad you're here. Yes, I know this inflammation stuff. It's crazy that they're saying that this could be the foundation of almost all diseases. So cardiac disease, chronic migraines, back issues, definitely, rheumatoid, lupus, all of these things that come up. So, okay, 10 signs. Chronic bowel issues, constipation, diarrhea, lots of gas, bloating. Okay. nutritional deficit, meaning maybe you're having some skin things, maybe there's just some signs that maybe you feel like you're low on nutrients. Having a poor immune system would be the third one. So, frequent colds, flus. Now, obviously, if you have kids in the house, all of this stuff, is subject to environment. Headache, fog, memory loss. So this I actually have a good friend. Hopefully she'll see this later. And she was suffering with headaches and also did this elimination with her provider or something similar, and she is doing a lot better. So it's interesting, the headache, fog, or memory loss, folks, this could be something to think about. Excessive fatigue, really hard to tell when we're all super busy, but if you're having excessive fatigue. Skin rashes in general. The skin, I will tell you, after doing this kind of work for 12 years, I feel like, because skin is our largest organ, it's often the most, you're in derm, it's so fancy. Well, okay, I mean, it's not like doing critical care heart work like you do, Lisa, but there's so much pathology with the skin, and it's sort of like this, it's this place that can give you, like, I always say that it may be raising like a red flag to say that there's something going on inside. Craving sugar and carbs is another sign that you may have the leaky or permeable bowels. Arthritis, joint pain, depression, anxiety, ADD, and ADHD. This is so fascinating to me because I don't even really think about the brain being so connected. I mean, I know that we have the brain-gut axis, but this really hits it home. In fact, I've had 3 concussions, and it was interesting that my doctor said, your concussions could also be a catalyst to this, because I got one, I don't know, 6 months ago or something. And I never thought about a head injury triggering gut inflammation, but she says it happens all the time. I was going to do another talk on that at some point as as I learn more, because that just seems to be like a whole other interesting part. And then the last one is if you already have an autoimmune, rheumatoid, lupus, Lyme's, there's a good chance that this is kind of running alongside it, playing alongside it, if you will. And they talk about doing the, it takes a process of healing that can be 6 weeks to 3 months or more, or an entire maybe life switch, right? So, again, I'm just kind of taking you guys on my journey. I don't know how it's going to end up looking altogether. I'm excited about it though, because I'm learning a ton of stuff, and I think it helps me too with the patients I see now, making sure I'm not just kind of throwing cream at something and letting it go. I mean, certainly we're not diving into these deep things, but I am aware that there was like more to the story going on, right? So I hope that you guys found this helpful, interesting. If you know someone that could benefit from this information, I would love for you to share with them. And I just so appreciate you watching. Like I say, so tomorrow I go for my nutritional appointment, which I'll probably get somewhat scolded for not taking all the things that I could possibly be taking supplement wise. I'm like, you can't go from not even a multivitamin a day to like the Ferrari plan. So anyhow, we'll see how tomorrow goes. I will come on again and talk a little bit more about this, but I'd love to hear from you guys if you have certain things that have worked for you. I think this concept, us ignoring that this is out there, is not the answer, because we're just throwing more medicine at this, more procedures, more medicine, more this, more that. If we could fix some things like on our own too, alongside obviously the help of others, that would be great. You are so sweet, Lisa. Okay, thanks you guys so much for watching. Have a great Tuesday.